To further explain what gender-affirming medicine is, Dr. Salim Surani joins us once again live to discuss this. Dr. Surani, it's always a pleasure visiting with you. This topic, I'm wondering how to get into it. For those who are against gender-affirming care, this is something that's been around for quite some time. It's been proven safe, effective. The medical community supports this. How do we explain to people how the process works?
Good morning, John Thomas. Glad to be here. One of the very is that I always address what the medical thing is. Let's leave the politics aside. Let's leave what the people believe are aside. But one of the key thing is we know that anytime somebody has the gender which they feel is different from their birth gender, I think that creates a lot of social pressures and stresses on them. So I think they're already going through a tremendous stress. And a lot of the time, I think, what the from medical point of view, I think sometimes they need a time, they need a support to figure it out what their gender they desire to be. And the question is that, a lot of the time people always feel that gender affirming care is just like going to the surgery and changing the gender, which is not. It's basically more of a social transitioning initially versus medical care because we know that they are going through a lot of stresses. And if you're not going to address front, they are going to have a lot of mental health crisis. The suicidal rate would be higher in those populations. And sometimes those children, they need a little bit more time. And that's where the puberty blocker drug comes in, where they get them some time to figure it out what they really want to be. And once that thing is done and taken care of with the support, and people can choose what their mind says that, but one has to be supportive from the medical point of view. Because if we don't, then there is a high risk of mental health care burden, especially in those populations. The people around them, the social area, they have to be tolerant too. Now, once they cross that stage, then that comes the medical, procedures or medicines or even gender-affirming surgeries. Those can, take on a much later part. But majority of the ones which initially are going to be is basically they are their mind is saying something what their body is, and then they are going through a lot of crisis. The question is, do we really want to go against and try to block those challenges and create a big barrage of the mental health care issue, which we already have a tremendous amount of mental health care issue, compounded by the COVID, compounded by the inflation, and then you go into those areas, we will have a very big mental health challenge. So that's the reason a lot of the healthcare uh, facilities are thinking, okay, well, let the people make their choice. And in life, we don't always take the choices. Drinking is bad, smoking is bad, but we do that. And people do take the choices. But we have to be supportive. We have to make sure we tell them the facts and what are the risk, benefit, advantages, disadvantages. And in the end, we can be supportive for whatever decision a person takes. But again, the rules, regulations, everything has to be done within the state of the law, and that is not for the medical community and the physicians to figure it out. We are there, just there. If anyone needs a medical care, we always will be there, without any discrimination from any sort of the things.
Mr. Surani, we always appreciate your input on this. We could obviously talk about this for the whole full 2 hours of First Edition. That is all the time that we have, though, for right now. If you have a question regarding this topic, please send us a text at 361-855-6397. Dr. Surani, thank you so very much.